Good morning and good afternoon. I'm pleased to welcome you to a Digital Health Hub Foundation webinar with 2022 sponsor Lark. Today's webinar will be recorded and shared. If you have any questions, please feel free to use the Q&A button at the bottom of your screen for us to address during today's session. My name is Melissa Faulkner. I am the VP of Marketing here at the Digital Health Hub Foundation. We are the producer of the world's largest healthcare awards that take place during the health conference in October. Our mission is to help the next best digital health companies develop ideas, validate, scale through events, webinars such as this, and of course, our digital health awards. Our award seeks to find the next best, most impactful digital health companies in 13 different categories this year and 2 different tracks. Applications are evaluated by over 1,000 digital health experts, and our winners are announced at our grand finale at Health on October 9th. Submissions are currently open, so if you are a digital health company with great ideas, please apply today. I would now like to introduce Anita, who is our moderator for today's session.
Thank you, Melissa, and thanks to everyone for joining us here. As all of you know, one of the largest challenges we have in healthcare is getting everyone in the system access to the care that they need and to try to get out ahead of acute events. But even here in 2023, we know that people of lower socioeconomic status, older Americans, rural populations, and populations of color have trouble accessing the care that they need. And when we combine that with our current shortage of healthcare resources, we are creating a really large gap in our healthcare system. Healthcare technology, particularly digital, has a real opportunity to impact this challenge. And a lot of different disruptive technology organizations are trying to tackle this challenge. As Melissa mentioned, I'm Anita Nair-Hartman. I'm the Chief Strategy Officer here at Lark. I've been in healthcare for over 30 years, working with payers, providers, and employers to address a wide variety of healthcare issues like this one. And I'm really excited to be joined by this great panel to talk about this very important topic. So let's meet the panel and then we'll dive right into our conversation. Julia, can I ask you to introduce yourself and Lark?
Hey everyone, it's great to be here. So I'm Julia. I am the CEO and co-founder of Lark. And we were really excited to come and talk about health equity because it's such a part of our mission. Our mission really is to help folks who are struggling with chronic conditions, at high risk of them, or struggling with stress and anxiety issues to have access to compassionate care anywhere at any time. And so this is a really exciting time for us as technology, which is, what we are, a tech company, really combining the best of conversational AI technology, behavior change science, and remote patient monitoring to care for people anywhere and at any time. So this is excited to be on this panel, and I'll pass it on to our great CMO, Dr. Lynne.
Good morning and afternoon, everyone, and thanks, Julia and Anita. As Julia said, I'm Dr. Lynne Nowak, Chief Medical Officer here at Lark. I'm an internal medicine physician by background. Prior to coming over to the industry side, I spent about 15 years in clinical practice as an internist. And prior to Lark, spent about 8.5 years working with health plans, PBMs, and employer clients. As Anita said, helping them solve some of healthcare's biggest challenges with affordability and access, and as we're here to talk about health equity. Here at Lark, I oversee our clinical product strategy team, our business insights and analytics engineering teams, and our clinical studies and research. What you see here, and we'll just spend just a second or two talking about this, just to give you a quick overview, as Julia said, for really how we're helping reach members with chronic conditions or at risk of chronic conditions. Just an overview here of some of the programs that Lark offers, with ranging from our prevention and wellness, where we're really focused on keeping people healthy and early detection and identification of issues and situations that put patients at risk. Prevention specifically for cardiovascular disease in our heart health program, as well as diabetes. in our CDC certified diabetes prevention program. And then we also have, of course, our condition management for diabetes care and hypertension care. All of our programs include what you see below there, which are education and learning modules and coaching and encouragement, and even our biometric devices focused on helping people get active, eat healthy, stress less, quit smoking, help stay adherent to their medications, identifying and addressing challenges with social determinants of health, and of course, sleep. So I'm going to hand it over from here to Krishanu, who's going to introduce himself and talk a little bit about Walgreens.
Awesome. Thanks, Lynn. And good morning and afternoon, everyone. Very, very glad to be here today. I'm Krishanu Evans, and I've been in healthcare for over 20 years, having worked with payers, health systems, pharmacies, technology companies, and helping them build and grow care delivery products and services and enable them kind of to move towards value-based care and alternative payment models. So as Walgreens has discussed externally over the past couple of years, it's taken some transformative steps in launching a new healthcare business. And that business is really anchored around its retail pharmacy, where Walgreens looks to build off of its strengths with its consumer trusted brand, national and local reach with its 9,000 locations within 5 miles of 80% of the US population, and scaled digital data and technology assets, all with the goal to engage and deliver care for consumers throughout their healthcare journey across both physical and digital channels. And in order to deliver on this goal, there's sort of a few key steps that Walgreens has been focused on. First is really securing assets and capabilities that meaningfully impact cost and outcomes and that are synergistic with this retail pharmacy. And this has been accelerated quite a bit with acquisitions in VillageMD and Summit, which provides at-risk primary care, multi-specialty care, and urgent care. CareCentrix, which provides benefit management services across post-acute care, home care, DME, palliative, and Shields Health Solutions, which further expand specialty pharmacy capabilities. Second are products and services that we look to deliver through our retail pharmacy channels, and that includes things like medication management and adherence services, health and wellness products, point of care testing, immunizations, test and treat programs, closing gaps in care, et cetera. And then lastly, ensuring that we have the right network of partners that have innovative solutions like Lark that can be brought into the care model and further drive engagement, outcomes, and quality. So Walgreens is well on its way to scaling its new healthcare business, and it has a very exciting journey ahead of it. But yeah, I think ready to jump in. Anita, do you want to take us to our first topic?
Great. Yes. So let's just go ahead and dive right in. And before we dive into the details, let's take a little step back and think of this from a macro perspective. Healthcare is complicated. There's a lot of moving parts, including state and federal regulations, privacy concerns, provider networks, and new drugs and devices. And we're always looking to innovate, but it's not an easy industry to innovate in. Can you share with us some of the challenges in introducing new and innovative technologies to healthcare? Just to set the stage, Julia, maybe you can start.
Yeah, it's such a complex industry, and I came from, and our team came from the tech world, and I just remember, the first 7 years we were in R&D doing tech. Spent about $140 million in building this AI platform to help patients and members. And I thought that was the difficult part. It actually, I would say the business innovation and the business plan innovation is so much more complex. And so the innovation that's happening really is multifactorial. You've got financial innovation. And I would say really COVID helped so much in shifting us from a fee-for-service to value-based care, society, which I think is really starting to align incentives. Otherwise, companies like ours, we have to consistently think about a multi-master problem. How do we help the employees or the members or the patients? How do we help the employers and their needs for employee happiness and retention and data versus the health plans needs versus the pharmacy's needs, and so there's it's not just the two bosses, it's the multi-boss issue, and it's hard to then really focus and do well because you have to think about everyone's needs and interests, especially since healthcare is not paid for by the user of the service. So I would say that the complexity of a healthcare tech startup, I think, comes from not only technology and technological innovation, but financial innovation. And I would say the other thing is really thinking about innovation in the framework of safety. And I think healthcare is rightfully so very conservative because we have people's lives, and in our hands. So how do you innovate while being really safe? Sometimes these are opposing forces, and so I think the learning for us has been, how do you create conversational AI, text message based counseling that is appropriate and careful and follows all of the guidelines, but is still engaging to the end patient. But the chief medical officers, like Dr. Lynne, who used to be at Cigna, they are comfortable with these services being provided to all of their millions of members. And so I think that understanding that and threading the needle is much of the battle. It's not just throwing ChatGPT at a problem, but really thinking about how do you use these tools to balance innovation, user needs, and safety. So that's what we've been spending the last decade trying to figure out, and still trying.
Yeah, Julia, I'll just piggyback on that a little bit if I can. You mentioned I came from Cigna. Prior to that, I was a part of the Express Scripts side of the house before the Cigna acquisition. And I was actually on the innovation team there, which was a great little microcosm and kind of pocket of innovation within a much larger, Cigna's a 200-year-old health plan. So as much as and again, not to talk about that specifically, but just in general, these large health plans, large PBMs, large hospital systems, the desire is there for sure. I think I've spent enough time with all of the different health plans and many different hospital systems. The desire to innovate is there for sure, but just moving, it's like moving an aircraft carrier, moving a battleship. It's just, there's so much complexity. These are large matrixed organizations, a lot of competing priorities when you think about the federal and state level regulations that all of them must comply with. I spent many years prior to coming to Lark leading interoperability with all of the new federal regulations around data sharing. Literally tens of millions of dollars being spent, if not hundreds of millions of dollars, at all the health plans and the hospital systems to comply. That's going to divert resources away from your innovation teams. And there's always that struggle there, which was actually one of the appealing things of coming to Lark, where, the focus at a startup, at a faster moving digital, health tech company is really focused on innovating rapidly. And really that is the focus, and really in many ways, the purpose of the company is to do new things and try new things. But to Julia's point, we still are working in the ecosystem that's very conservative and doesn't move very quickly. So you've got those opposing forces as well. And then figuring out the business model, and that financial innovation that she referenced, how does a rapidly moving health tech company figure out a business model that's going to work with, a more conservative health plan or PBM or hospital system provider partner, is exciting, but also very challenging.
Yeah, and if okay to jump right in and to piggyback a bit on some of the, I guess, the big company perspective, right? So as Julia and Lynne have described beautifully, innovation and disruption are critical to drive progress in the health industry. But in my experience, what I've seen is that many innovative healthcare technology companies crash into the challenges that come with scaling. There's many great companies out there with amazing solutions that struggle to grow beyond their first couple of markets. And I think the difficulty that many organizations face is that healthcare operations are highly complex and highly local. Each market has its own unique needs and infrastructure. And in order to drive scale, you need to be able to bring together these innovative technology solutions and digital solutions with the local market operations. And in today's market, as Lynne was describing, right, the national and local infrastructure are predominantly controlled by incumbents. But these same incumbents, right, are, as you just said, are often struggle to innovate in their markets as they have existing businesses they need to run. So I do think it's critical for new innovative organizations to partner closely with existing incumbents in order to drive scale and impact.
Yeah, I totally agree, Krishanu. I feel like Walgreens has taken such an innovative way of expanding into core healthcare and bridging this kind of consumer-centric care and local care, and bringing that flavor of consumer-centric, patient-centric delivery and delightful delivery to healthcare. And I really appreciate, when we're working together and collaborating, it seems like there's just so much interest in bringing different parts of the ecosystem together rather than building all of it on your own. And I think that it's these integrated products and workflows and collaborations that really start to move the needle at scale.
Well, and I love the focus on, we hear a lot, and there certainly is a lot of importance in population health management when we look at the broader macro picture, value at a population level, return on investment at a population level. All of those things are critically important. But as Krishanu said, all healthcare is truly local, and it doesn't get much more local than down to the individual person that you're trying to impact and improve their health. And so when you really think about taking it down, when we talk about access and equity for the individuals that we're trying to impact, there really becomes that challenge of how do you make an impact at a population level, but still personalize it to the unique needs of each specific, individual, and still have that impact, one person at a time, and make sure they have the access and ability to get that care, even at a local level, maybe even, specifically in their own home or in their own pocket, which is really what Lark strives to do.
Great. Terrific. So let's lean into that a little bit, right? Because innovative solutions, and I think each of you touched upon it, really only benefits when the patient or the consumer can get access to them, uses it, right, engages with it, and finally, that the ecosystem can afford it. And maybe you can each share your thoughts, and we can kind of break it up. So Krishanu, maybe let's start with access, right? And share a little bit about your and Walgreens' perspective on this.
Yeah, no, happy to share my perspective on it. So I think, in order to meaningfully drive health equity, you do need to ensure equitable access to care in underserved and underrepresented communities. And as we know, health disparities are driven by social and economic factors such as economic instability, neighborhood and physical environment, education, food, community, safety, social context. And, for those of us in the healthcare industry, there are gaps in the healthcare system across coverage, provider and pharmacy availability, and quality of care, all of which, right, impact health and well-being, mortality, and life expectancy. So given this complex multitude of factors, we do need to meet consumers where they are and ensure healthcare services are accessible through both physical and digital channels that are tailored to meet both individual needs as well as community needs. like, sort of, for example, how you end up deploying access to healthcare services will be different in urban communities as it would be in rural communities. So what this means is that you'll need to dynamically bring together in-person services that are highly convenient and embedded in underserved communities, along with services that are accessible in people's homes, including virtual and digital programs. So, local providers, local pharmacies already have long and trusted relationships in underserved communities across the country. They're already embedded in these neighborhoods and allow them to be trusted and convenient sources of care, but there's not enough of them. There's gaps, they need further support, but they can be benefited through partnerships with innovative digital health companies who can expand and amplify digital and virtual reach and help take some of the burden off of under-resourced communities. But that's kind of general thoughts on access. Julia, Lynn would love anything additional that you'd like to share.
No? Okay. So maybe Lynn, I'll turn to you as our clinician and the person whose team is, thinking all day long about keeping patients engaged and enrolled and et cetera. Share some thoughts on the engagement front.
Yeah, as I kind of mentioned before, the importance of that personalization, and that's really, I think, a key driver for successful engagement, right? And when we think about the local level and tailoring the needs to what's going to work for an individual person, everybody has a different schedule, everybody has a different personality. Each person's going to have individual goals of care that are going to matter to them, or care plans from their provider that they're going to need to follow differently from their neighbor, differently from someone in a different part of the country. And maybe it's going to differ for them throughout different parts of their lives. So, the ability for a digital solution, using and leveraging the technology and the data to really get as specific as possible to the unique needs of that individual is really going to help keep them engaged and also going to help drive those outcomes. When you've got, someone who may be a shift worker and, they're working through the night, they're not going to be as able to, leave and go to a provider, during their daytime, which is really nighttime because they're sleeping during the daytime. Or for folks who are working during the day, during normal working hours, they may not be able to leave their job to go to doctor's appointments easily, or they may not have childcare to go, to a human face-to-face engagement. And this is an area where I really think that digital solutions and technology solutions can really help fill those gaps and help serve those members, without disrupting, their lifestyle, but still getting them the care they need and the support they need. And then when I think back to my days practicing, in the office, when we would have a patient in the office and you spend that time with them, hopefully you have the time to spend with them, which realistically we all know doesn't always happen. Doctor's visits are short. We're usually running late. We usually are unfortunately in a bit of a rush and sometimes can't be as thorough as we would like to be. The digital solutions can both step in to supplement and augment, what there wasn't time to do in the office, directly with the provider. But also between those visits, historically has always been a pretty dark period. We don't really know what's going on from visit to visit. And those visits could be 3 months apart, 6 months apart, maybe even as much as a year apart or more. And being able to use digital personalized solutions between those visits helps keep the patients engaged in the meantime, helps gather data and analytics that, can both help give more tailored advice and coaching to the patients, but also then feed that information back to the doctors so they can make, and other providers, so they can make better decisions in the patient's care. And it also can just help really keep moving things along to keep the person engaged in their health, not just, the week before you go to the doctor, because you're going to have your cholesterol checked. So we all try to eat healthier. It can actually help keep you on track along the way. So I think just the personalization, the ability to kind of have that ongoing engagement between visits, and then the ability to capture the data that can help inform both the doctors and the patients along the journey is a really valuable tool that digital helps us bring to the ecosystem.
Yeah, I think that so much about care is not just about, the treatment of the sickness, but about the holistic care, the 98%, rest of the time. And what Krishanu said, what Lynne said, around, personalized engagement, where the member, the patient, the user is, whether it's at home or in their local, environment. That's how we extend care into wellness and living your best. And so I think when we work with health plans, and we're managing a population of about 35 million for health plans, it is the difficulties of giving access to personalized, engaging care that is a real challenge for these health plans, because health plans and doctors, of which there are not enough amazing doctors and nurses. It's just it's the typical supply and demand issue, and so you're seeing huge disparities between local, rural areas and urban areas. And so I think that for us, we really approached it as, okay, what's always there with you? Well, it's your phone. So we took the leap, a decade ago when smartphones were starting to become popular, and starting to go down in price. And Walmart was starting to carry those $30, $40, $50 phones that could still use data and texting and apps. We just decided, instead of focusing on web only, which is a big trend of the time, we decided to go mobile only, use all of the phone sensors on the phone, take advantage of all of the remote patient monitoring, the IoT that was coming out, and create a mesh of passive data, so we could start to really understand the contextual needs of a person and how they, their conglomeration of habits, how they lived and moved through their environment, and to be there kind of coaching them whenever they needed, whether it was 1 a.m. at night because they put their kids down and they could finally have a little bit moment to themselves, or at the grocery line, and so we really tried to work on access in that way, and so far we've been, we have about 2.5 million patients on our platform. We've been able to really push into the healthcare provider shortage areas. And the next phase, where we work with partners, is really, great partners have live humans helping, right? And that's always going to be needed. And whether they're local, like in your local Walgreens pharmacy, to kind of extend care. So instead of waiting that next month to see someone like Dr. Lynne, like you can actually say, oh, why aren't you, why aren't you taking your medications? Oh, I can't afford them. We'll actually go here, or, just drawing people back into their local healthcare environment through digital means. And I think that's where a lot of the richness is going to come from, as these different types of healthcare companies start doing all of these interesting collaborations.
Well, Julia, I love the word you use as far as extending, right? I mean, when we think about, an extension of the traditional healthcare ecosystem. So I think so many times when we talk about digital, certainly when we start to get into conversational AI and some of the anxiety that's, understandable around AI in general. And then, of course, with the recent release of ChatGPT, all kinds of, exciting opportunity, but also appropriate anxiety and risk aversion there, that I think there's a natural tendency to think that folks in the health tech world are trying to replace our providers, or, can the digital be doing diagnosing and treating and taking the place of a doctor or nurse. And I think it's really important that, it's not that we're replacing the providers, is that there simply are not enough doctors around. There are not enough pharmacists and nurses to give that direct care. So it's really about how do we leverage the technology to complement them and augment them and be an extension of those human direct care providers to help fill the gaps and help really increase the access to folks, either whether it's a geographical limitation or a time and scheduling or a financial limitation, or they just can't get into the provider they need to in time. The technology is going to be what helps us fill those gaps. And it's not intended to replace, but it's really intended to supplement and complement and be used as an extension, to areas that you just can't reach with humans, because again, it's the supply and demand. There just aren't enough humans to go around. And the cost of those humans also becomes unwieldy for the system, even they did. So using technology where it's appropriate, allowing those humans to practice at the top of their license, truly engage with the sickest of the sick that need a human face-to-face or live visit, and then, offloading some of the simpler, day-to-day things that can be done with technology really helps, I think, increase the value of those clinicians and humans while leveraging the value of the technology as well.
Yeah, no, I think that's spot on. I think, while patients do frequent their doctor's office, retail pharmacies, there's still transactional moments and they're not continuous, right? And I think it's critical to, continue to engage consumers between their primary care and pharmacy visits, to ensure that they're staying on track, following their care plan, continuing to take their medications as prescribed. And yeah, this is where digital and virtual programs are critical to continuously engage those consumers in their health and well-being. And also, what I've found is that, when these programs are partnered or delivered through kind of a large incumbents platform, you also get the advantage of that scale, that consumer recognized brand, which can further kind of increase reach and efficacy. But fully agree, I don't think it's about replacement. I think it's about extending the reach and capabilities of the provider, supplementing those capabilities, and then also providing a channel for continuously engaging consumers between those doctor visits.
Yeah, I totally agree, Krishanu. Like when we found pharmacists were the ones recommending and onboarding patients, the enrollment numbers shot through the roof because the pharmacist was such a trusted, part of their daily, or monthly community for their health. And I think that there's something kind of magical where you have the pharmacist who is really, both local and very well educated clinically, and you're seeing the extension of the doctor and nurse into the pharmacy and closing gaps in care, and so it's really fun to play with using technology to sort of remind people to close gaps in care, and then to drive them to the pharmacy, to the pharmacist, to the clinics. And I love how the healthcare clinics are now being kind of localized as well.
Well, and Julie, you mentioned earlier about, helping people stay well, but also, early detection and screening. And, when we think about closing gaps in care, a big part of that process is identifying what are the barriers that are preventing people from doing what we want them to do. So if they're not taking their medications, or maybe they haven't gotten their refill, why is that? Is it because they have, transportation insecurity? They don't have a vehicle to get to the pharmacy. Maybe they can't afford their medication. So, Do we need to think about and engage with the physician or engage with the pharmacist to see if maybe there's a lower cost alternative that could be switched out to make it more affordable? And that's also something that, which we have introduced our screening capability without going through a long discussion with the patient that would take a lot of time for a live person. We can very quickly, through the digital tool, do those screeners and capture that information and help identify those barriers and really navigate and help refer patients to either help with whatever their challenges are, or at least share that data with our partners to tee up for them what are the challenges their patients are experiencing, and they can help, connect them up with resources as well. So, I think it's a lot of those things just go undiscovered in the live interactions. We don't always dig deeper. Certainly, I can speak for myself back in clinical practice. We would identify, my job as the doctor was to diagnose the condition and pick the appropriate treatment and write the prescriptions and, send the patient on their way. And I think we're just recently, in the last several years, understanding, that's not where the care needs to stop. I mean, so many of those patients never get those scripts filled, or if they do get them filled, maybe they have side effects and they don't want to call their doctor. They're embarrassed to tell their doctor they can't afford the medicine. But in a non-threatening, non-judgmental, mobile app, you can put that information and we can find out, really kind of get deeper on what are some of those challenges folks are experiencing and try to connect them with help.
Great. So we've talked about access and we've talked about engagement and how, there's ways for all of these different parts of the healthcare ecosystem to kind of complement each other. But now I'm going to ask about the elephant in the room, which is cost, right? Like, how do we think about how the ecosystem can afford this when we're, quite frankly, spending a lot of money in this country on healthcare, and healthcare costs and trends are going up. So how can we think about that and the way, these kinds of capabilities can kind of fit in? And Julia, I'm going to pick on you and start with you first.
I think cost is so much a part of the equation. I was just looking at, I think we spend $4 trillion a year on healthcare. And I think more than 50% of that is the clinical care. And so how do you shift this huge cost curve when there's so many different parties and a lot, interests, and I actually think what we've been talking about is a really interesting way to shift that cost curve down, which is use people at the top of their license. And so when you use people at the top of their license and build this pyramid, you can more and more automate, certain things that were done by very expensive doctors or nurses, and still keep the cost somewhat reasonable. And so, for us, it's really thinking about, we don't think that AI is going to take over healthcare. We just think that AI should take over repeatable, safe, data-driven pieces of care that is either not being done today because it's so expensive to be doing it with humans, or that could be big operational savings if you transitioned it to technology. And the importance is really to then link those into the correct levels of care and providing data at the doorstep of people that then need to get escalated to this care. So I guess what I mean by that is, for us, it's not like we don't have any humans in the loop. It's that when we see a triage specific issue, we escalate to the care manager or the provider, and then we dump data at their doorstep so that they can perform at the top of their license. But we're managing and making sure that the person is, taking their PHQ-9 surveys to make sure, oh, this person is not doing so well mentally and needs help. So here you go. And so I think, for us, it's how do you create that portfolio of balance? And just as a, kind of back of the napkin, someone said, well, how many people do you guys represent? And so we just did some calculations. So one year we had 355 million text messages back and forth with our patients. And if that were people texting back and forth, we would have had to employ 15,000 folks, full-time nurses or coaches at the time. And that's totally cost prohibitive. So these are just some examples from a tech perspective, how we should really start thinking about cost correction.
Lynne or Krishanu, any thoughts on that to add?
Yeah, no, I'm happy to jump in again. So I think, I think when you look at it through the lens of sort of existing payers, providers, pharmacies, they already have the benefit of kind of, like I mentioned earlier, local and national operations, which do allow them to do many things at scale in a cost-efficient manner, such as deliver their core business products and services, supply chain and last mile capabilities, digital and technology deployment. And additionally, they've been making a lot of investments behind assets that they see as critical, needed to impact cost and outcomes, and are synergistic to their core businesses. And they're leveraging that infrastructure to scale them. But with a scaled operation, right, it's not always easy to test, pilot, and innovate within that structure. And it's highly expensive to do so, right? And as a result, there are services that don't necessarily make sense for large incumbents, existing providers, pharmacies plans, right, to try to develop internally. And I do think, you're trying to, like Julia was saying, you're trying to strike this right balance here. And I think this is where, finding the right partners that can bring together the right solutions, technology, tools, services, in order to enable providers and help them more effectively impact cost and outcomes, becomes an approach that can be, both more cost effective as well as a capital efficient way to scale.
Yeah, Krishanu, I love that. And, I think the word that keeps coming back is sort of this collaboration, sort of the bringing together the best of both worlds, where you have kind of the speed and focus of, the innovators and the smaller, more nimble companies that are bringing new ideas and can rapidly prototype and deploy things quickly and fail fast and fail forward, and all those, buzzwords we like to use kind of on the tech innovation side. But marrying that together with partners who have size and scale to bring those new capabilities to market and deploy them broadly in a cost-effective manner. So, I think Anita, wants us talking cost here, that when you're leveraging the technology, you're so much more able to reach people that you could never reach with humans. So when we talk about the supply and the expense of human clinicians, because of that, we really have focused so much on the sickest of the sick. It's that top 5 or 10%, understandably, because they are the most sick and they need the most care. They also are generally the most expensive, and they are costing the system disproportionately compared to the other 90 to 95%. But that also leaves you with 90 to 95% of the population that are really not getting much attention. Maybe they're at risk of a condition that could be prevented or could even be, reversed if they would get additional care or coaching or, started on a medication earlier, but they just don't hit the radar until they're actually sick. And until they actually have a problem, they really kind of stay off of everyone's radar, where a scalable, affordable way to reach them through technology, you can detect those things earlier, you can get people on treatment earlier, you can coach them for lifestyle and behavior changes that could potentially even prevent those problems from happening. But you have to find that scalable, affordable way to get to them, which I think is where digital comes in.
Right. So just to round out our conversation, right? Lots of interesting ways that technology and traditional businesses can kind of band together to tackle these challenges of getting care, access at very affordable costs. And as health tech organizations think about taking their capabilities to the market, what kind of advice would you have for them relative to commercialization of solutions and services, and how should we think about that?
Well, I'm happy to share some initial thoughts,
Yes.
right? So, and I think some of these points we've probably touched on in various ways, but when I think about value-based care, right, today, pharmacists, healthcare providers, they're all incredibly busy with high burnout rates and labor shortages. And meanwhile, as value-based care, alternative payment models are being implemented, more and more is being asked of our physicians and pharmacists, which is creating sizable burden on them. So what I think is that for these value-based care models to be successful, we need to have providers focused on delivering care and operating at the top of their license. And that means that digital and technology companies need to bring forward solutions that enable providers to operate within value-based care, stay hyper-focused on care delivery, help them extend their reach and allow them to provide more care with lower effort, and remove any non-value-add administrative burden. And I think we've kind of been touching on this theme of marriage between large incumbents that can operate at scale, but have heavy cost basis as a result of that. If new tech companies can partner with that to create the reach and scale, but also drive efficiency, I think that's where you start to get a value in the business model coming together.
Yeah, I'll kind of add to that a little bit when we think about sort of from the provider side of, entering into these value-based care arrangements and taking on more risk and more accountability for outcomes. What I think historically, when you think all the way back to when, the Affordable Care Act was passed and really trying to drive more towards affordable care and accountable care, the big missing piece for that, taking off the way I think everybody really wanted it to was data. And if you're going to ask providers to take on more risk, most of them get it. They want to be accountable. They're more than happy to drive towards better outcomes with their patients. That's why we all went to medical school. We want to help get people healthier. But not having the information you need to make the best choices and really, confidently take on that risk because you know what you need to know about your patients at both the individual level and the population level, was really, I think, a big part of the challenge of getting value-based care arrangements to take off. Now that we've really started, finally, after over a decade, really leaning into interoperability of information and sharing data and using that data with some of the advanced analytics techniques that we have, machine learning and things that didn't even exist a decade ago. We now have the ability to leverage the tech, leverage the data that the tech generates and pull that into, analytics and predictive modeling that can be used by the providers and the health plans and payers to enter into these value-based care arrangements much more confidently, right? And be successful. So everybody is winning along the chain. Most importantly, the patients who are hopefully getting healthier, as a result of using the tech and data and delivering, and getting better care by their providers.
I'm just going to pile on because I totally agree in these words of, data partnership integration that these folks have used. I just, it really reminded me, I had a lovely conversation with the chief health officer of Centene recently, Dr. Alice, and she was saying, I think everyone thinks that innovation in healthcare is going to look like some new sexy app. But really, it's in the integration of core work streams, and it's in the integration of these potentially sexy apps into actual care. And And it just reminds me how important, those conversations, those brainstorms, those hackathons are with our large partners, whether it be large national health plans, large pharmacies, pharma companies. It's just trying to bring the data into the correct workflow, bring the technology enablement on the front end with digital mass enrollment, mass patient engagement, mass member engagement, and funneling those folks into the right levels of care or the right resources within these huge existing infrastructures. So I think that, certainly, that our partners have taught us a lot in that respect. We used to be just the tech company on the side, but to be able to work with these executives like Krishanu, like others, to bring the technology and push it all the way through to impact the actual next best action, or the actual care, is super exciting. And I think that would be the advice, to listen to your customers in that way.
Great. Well, I think this has been a really great discussion, and I love that we have identified that the perfect solution, we think, to solving for access and care for all, regardless of where they live or socioeconomic or other challenges, is really a great marriage of traditional care, traditional capabilities with digital health as a real accelerator. So I want to thank all of you for a really engaging discussion, and I'd like to thank everybody who came into our webinar and spent the last almost hour with us. Melissa, I'll turn it over to you.
Awesome. Thank you, Anita, so much for your wonderful moderating skills, and to Dr. Lynne, Krishanu, and Julia for joining us today. As I shared at the beginning of the session, this was recorded and will be shared out to all of the attendees. Again, thank you so much. Have a great rest of your day. And again, if you are a digital health company looking to be recognized at our awards, please go ahead and apply. Thank you and have a great day.